Ethnic rhinoplasty is a major subject by itself. The primary ethnic rhinoplasty primarily consists of the Asian nose, the African American nose, and the Middle Eastern nose, each having their own particular characteristics. The important part for a good rhinoplastic surgeon is to make sure that the patient has an awareness of the parts of the nose they would like to see changed and corrected so that they do maintain their ethnicity, but at the same time improve the general appearance. With the Asian nose, the most common concern they have is the nose along the top is somewhat flat. So very often a implant or a graft is inserted in order to build up the bridge. Also, the nostrils are often round and you want to create an oval shaped. And the tip itself is somewhat rounded as well, and you want to give it more definition. Going into the African American nose, one of the major concerns there is the tip itself is somewhat flat. It has less projection. Sometimes it can be very wide, and the nostrils themselves often are more horizontal, and the object here is to create a more vertical shape to the nostrils to give a little more projection to the nasal tip and sometimes narrow the nasal bridge. And then the last ethnic rhinoplasty is the Middle Eastern. And the Middle Eastern nose is characterized often with a very large hump on the nose. The nose tends to come down and gives the appearance of a very large nose. So in that particular case, very often the nose is shortened, bringing up the nasal tip. The large dorsum is then lowered down, and in essence, one is reducing the overall size. The most important part about performing ethnic rhinoplasty, however, is to make sure there is a good communication and an understanding between the rhinoplastic surgeon and the patient. Thus, we use computer imaging to make sure there is a clear understanding for the proposed result can take place, and hopefully at that point, the patients then will have a realistic expectation.